So dog dental health covers quite a large area, obviously, from our dog's mouths, from the very front right into the mouth itself. And it's something that we all know that we need to keep our dog's teeth clean, but it's knowing how we can do that. Sometimes it helps to know why we're doing it, and also, what is it that we're looking for when we're trying to assess whether our dog's mouth is clean or not. So this is, like I say, the first day, and so what I wanted to talk to you about was what are we looking for when we are looking in our dog's mouths. So Ripley, come on, baby. Yep. So we've got Ripley's Choppers here. This is my 5.5, nearly 6-year-old Norwich Terrier with a giant fringe, isn't it? Because my other two are napping at the moment. Basically, when we're looking in our dog's mouths and when you're trying to assess whether your dog's mouths are clean and healthy, if they need anything, if you need to take them to the vet to get anything checked, we're looking at more than just what you can see at the front. So often when our dogs are looking at us, if their mouth is open, good girl, we can see what the front teeth are doing here. Okay, so you can see Ripley's front teeth here, can't we? Yes, we can. And just because we can see the front teeth there, and they might be nice and clean, nice and white, it doesn't give a good indication of what's happening in the whole mouth. When we're looking at the dog's teeth and when we're looking in their mouths, we want to be aware of top teeth, bottom teeth. We want to be aware of what the colouring looks like. Are the teeth intact? Is there any wear happening? So do they look like, does one look like it's smaller than the others? Any cracks or anything like that that's happening there? Are all the teeth there? Is there suddenly a gap that wasn't there previously? Now, Ripley here actually only has 3 teeth at the bottom and 3 teeth at the top between the canine teeth, which isn't usual. She hasn't had any actually removed. That's all she's ever had. And her mum had similar. So it's a genetic-y type thing, isn't it? But what it does mean is that she's nearly 6, and for all this time she's always had these natural gaps in between her teeth. It means that her teeth aren't straight; they do go off at a bit of an angle. Doesn't affect anything else that she does, but it does mean that she's going to have more chance to get dirt and bacteria and things like that in between those teeth. Whereas when you have the full set, which is normally around 6 teeth, bottom and top, they are pushed right together, so nothing can get in between very easily. So Ripley is a candidate dog to have more issues with her teeth because she's already got an issue with her teeth, if that makes sense. Okay, so as a dog, it doesn't affect eating, doesn't affect drinking, doesn't affect playing or anything else. But I do need to keep an eye on her teeth a little bit more because of the gaps that she's got. So even just at the front of the mouth, we can look at the teeth, top and bottom. We can have a look for any breakages, any damage, any discoloration. Okay. The other thing that we should be looking at the front end of our dogs is also, or our dog's mouth, should I say, is also the gum line. Okay. So not always as easy to see. And if our dog has their mouth while they're panting, you're not always going to see what the gums are doing. So to give you just a little idea, if we go up and down, we can see the gum line there. And so from that, good girl, mwah, such a good girl, we are looking to see if the gums look the same all the way along, because if there is dental disease, gum disease, often you'll find that a gum line, an area on a tooth will lift up higher and it'll be more receded, or it might be that all of them are receded. So actually you're seeing the thinner part of the tooth appear with the very root. It might be that when you have a little look, the gums don't look how you're expecting them to, and they are an unusual colour. It's worth, from this moment on, having a look at your dog's gums, by the way, if your dog is comfortable with you doing so, because if you know your dog's gums look like normally, you'll know when there's a problem. Okay, if they are bleeding, if the colour looks completely different to what they should look like, things like that. If you've never looked, then you're not going to know. But seeing what they look like, top and bottom, anything going on, is there bleeding happening? Do they look really sore? Do they look really inflamed? So having a little look all at the front end of the mouth is your very first point. Okay. Now, once you've had a look at the front, we want to start working our way around. So you have the large teeth that are kind of here and here, which are literally the canine teeth. That's what our dogs are using for tearing and when they're having a real good game of tugging and things like that. And they are one of the first places to get a lot of discoloration, a lot of plaque happening, which obviously then gets worse and worse and worse, becomes the tartar. So having a little look at those is a really good place to start. They're one of the easiest teeth out of all of them to try and clean and brush. The front isn't as easy because we have to kind of lift up and try and get in there. And a lot of dogs aren't keen. And obviously the back teeth, you've got to get, you know, right in there. So the canine teeth can be the easiest ones to start with. So you can literally lift up and you can get to the canine teeth here. So top and bottom, and just working, good girl, on those teeth all round. You may notice I'm rewarding and praising Ripley a lot whenever I'm looking at her mouth. This is something we will be talking about, which is cooperative care or collaborative care. It's also started being known as, and it is basically making sure that things like examinations of our dogs are positive and our dogs are happy with it and relaxed and not stressed, and it makes it much easier to do. As you can see, she's quite happy for me to do it, aren't you? So yeah, canines are next. Same sort of thing. What the gum line's doing? What do the teeth look like? Are they wobbly? Has your dog lost one of those canine teeth? Is there a crack there? Sometimes you'll see a lot more wear of these than anywhere else in the mouth, and that can be from eating, you know, dental chews and things like the antlers and equivalent types of things. It can also be if your dog likes to chase a tennis ball or other toys that have got an abrasive type material. And it's often not because they're necessarily chewing them, although chewing can cause a little bit of wearing happening. But also, if your dog likes to run with something like a tennis ball or something similar in their mouth, the art of running means that the head is going up and down, which means that there is a lot more happening where they're holding onto that ball and they're going to be wearing the teeth. So you want to be aware of that. Any age, but especially if your dog has been going for a few years, you know, liking chasing a toy and carrying it, because if that starts to wear down too much, you can get to the point where it's going to get discomfort. It's going to be not very nice for your dog. It can lead to other issues with the teeth as well later on. So just keep an eye on it. And if you find that actually, yeah, there is some wear happening, just when you next see your vet, let your vet see and just let them know, just to rule out any problems starting to happen. From that area there, we then have the back of the mouth, which is the hardest part to get to. Once you can see into the back of the mouth, you will start to see that's, you know, if there's any plaque happening and tartar happening, that is where you're going to be feeling it and seeing it and noticing it the most. Again, the gums might be a little bit inflamed. It's a fact that a very high percentage of dogs over the age of 2 to 3 years have got periodontal disease, have got something like gingivitis, where they have got inflamed and slightly receding gums, where they have got bacteria under the gum line. It will then obviously start affecting the teeth, because once the gums are not healthy, teeth can start wobbling. If you get teeth wobbling and falling out, then you have gaps, and then more teeth will start falling out, and it becomes a bit of a knock-on effect basically. So we want to keep everything clean and tidy and healthy, and that's what we're going to be working on. So when we're looking at the back end of your dog's mouth, again, Ripley's got quite a lot of moustache here, so I'm just getting that out of the way. But we want to be able to lift up the lip, put our finger in here. I know, it's all right, darling. I'll give you a little treat for that because you're being a good girl. Yes, we are. Good girly. And then we'll have another little look. So Ripley's got a tiny mouth, but we can just about see in the back there. That's a tooth. She has got a lot of plaque on there, haven't you, my love? Tartar, should I say. Her teeth aren't great, like I say. And I'm aware of this. And that's why I work on it a lot. So looking into the back there, again, getting used to your dog's, what your dog's mouth looks like. So when we talk about brushing your dog's teeth and keeping their mouth nice and healthy, we are talking about top and bottom, front, side, and the back of the teeth as well, as much as possible. It's not always easy to do, but we have to start somewhere, okay? So I know, you're a very good girl. Another thing you can check, and again, any age of your dog, will be what their breath is like, because your dog's breath, if it changes, same as with us, can indicate lots of other things taking place. So if you start finding that when your dog is sitting either near you or eventually not that near to you, and you're thinking, oh God, that doesn't smell particularly nice. That can be indications of things. It can be an indication that something's going on within the teeth line. There may be an infection, something happening under the teeth. It can be, again, that your dog's teeth are just really in need of a good scale and polish, and work with your vets, some good brushing from you to help everything be much nicer, it can actually be an indication of other issues as well. Now, when our dogs' mouths become unhealthy, when they start getting things like gum disease and other types of issues with their teeth, bacteria is forming. It's what's on their teeth. It's what's causing all the issues in the first place. But the bacteria there actually starts then being swallowed in their saliva and when they're eating food, and that bacteria then gets into their system in other places, and that can then cause other problems. So it might not always be actually their breath that you can smell when there's a different scent or aroma. Actually, it can be coming from much further down inside your dog's body, but originally caused by dental issues. Okay. So I will just mention I am not a vet, I'm not a vet nurse. This is through doing the job I've done for over 20 years, from all the dogs that I've lived with and owned and worked with, and doing lots of research, talking to my vets, etc., etc. Okay. Obviously, have an appointment with your vet or your vet nurse. A lot of the time there will be teeth clinics. So it's pet dental health month at the moment, so a lot of vets practices are actually having different bits and pieces going on at the moment and putting out lots of information. So go in and ask them to talk you through what you're looking at and what they recommend. So keeping it healthy isn't just about the teeth, it's about actually looking after the whole body as well. So we are going to be looking at lots of different ways of keeping a dog's mouth nice and healthy, because we appreciate that not all dogs are happy to have their mouths even looked at, let alone having toothbrushes and goodness knows what else taking place. So there are lots of things that we can do. There are ways that we can help our dogs to help themselves with things that we can give them, so toys and chews. There are different types of products that can go onto your dog's food, go into their water, and there are lots of things that we can be doing. And it doesn't always involve a brush, although brushing your dog's teeth is pretty much the best thing that you can do. But if you can't do it properly because your dog really isn't keen, then rather than doing nothing at all, it is better to do something at least. So we've got tutorials to take you through this and some homework for you to have a little go at. When we've got homework for you, it's up to you what you do with it. You can just do it. You haven't got to let us know what you're doing. But we do ask, if you want to get any feedback or you'd like to be part of the challenge, then you can let us know how you're getting on. You can, update us. You can take part in the questions and answers and things like that. And then the more people that are taking part, the more people we can help and answer your questions more directly that way. So you have got tasks coming up. The task for today, for this first one, is going to be asking you to see if you can have a little look at your dog's mouth and give them a little bit of a scoring 1 from 10 to see what their mouth is like at the moment. And it's not judgment. I don't want anyone to feel embarrassed. Like I say, Ripley's not 6. Her teeth, they always and they will always need a fair amount of work. Merlin, my other Norwich Terrier, is 12 now. He actually had teeth removed when he was 6. He had he's all his front 6 at the bottom here between the canines. By the time he was 6, actually were loose. They were wobbling a little bit. The dentist at the time that did his surgery, he said, to be honest, they're moving, they're wobbly. I think we should take them out now because they're going to have to come out in a year or two anyway. That's more anaesthetic, which isn't great. So I said, okay, take them out. And he hasn't affected him at all. But he has a much healthier mouth because of that. He hasn't got to have the worry of a tooth falling out, another one falling out, and then infection setting in. It's gone to sleep. But what the vet actually did say to me was, it's not uncommon in dogs that don't play tuggy and that don't really chew things. And Merlin is a dog that doesn't really do either of those things. I'll go into this in more detail on another talk, but basically when our dogs are playing tuggy, not too heavily, so if you've got like a 12-week-old puppy, you don't want to be stringing them up on a toy and playing tuggy that way. But little bits of tuggy throughout your dog's life, actually, as they're pulling on that toy, they are strengthening the jawline. They're strengthening all around the jaw, top and bottom. And when the jawline is healthy and the gums are healthy, it helps keep the teeth healthy as well. So it all ties in really nicely. And Merlin has never been a dog that particularly likes to do any sort of tuggy. When he does occasionally play a little bit, I mean, you have to be really gentle. Not like with Ripley where you can chuck her about, but you have to be really gentle. It's, oh yes, what a good boy. And if you pull it slightly too hard, he will just let go. He really isn't that bothered about tuggy at all. So he's never really worked on building anything up, and he's not one for chewing. Weirdly, for a terrier, you'd think terriers would be right in there. But although my dogs are raw fed, and they do get bones, recreational bones to chew, he will just try and swallow it whole. He doesn't like to actually get in there and give it a good old gnawing. So because he's never done that either, again, he's never had the chance to really build up that jaw and build up the strength. Hence the reason by the time he was 6, he had teeth that were wobbling, because he'd never actually helped himself get them strong. So I'm not suggesting that you go out now for whatever age your dog is and give them, a great big knuckle bone every day. And get them pulling on everything they possibly can for some tuggy. But what I am mentioning is that there are some things that our dogs do or don't do that can actually cause issues. It's not that he had a particularly bad mouth. His mouth weren't great, but it wasn't that particular reason. It was just that he hadn't really done a lot with his mouth and with his jawline. So little bits of tuggy are good. Little areas of using dental chews and dental toys and things like that can all help. But the average dog, generally speaking, if they do play or they do chew things, will actually make themselves that little bit stronger. So generally it's not a more common issue. More common, it's that the gingivitis and periodontal disease and gum issues are the more likely reason for needing to have teeth taken out or for teeth to fall out. So yes, so you're going to have a task coming up. There's going to be information in the email that you are reading through, that this video is attached. You're going to get this coming through for the next couple of days as well. So and they will stay there. They don't go anywhere because they're in your email. So you can look back at these as much as you want to. You can delete them, you can forward them on. It is entirely up to you. It's here to help you at the end of the day. Okay. If you do have questions, then you can ask away. We are going to be doing some lives both in our Facebook group, which there will be a link for that in your email, and also on our Instagram page during these 3 days, so that people can watch in real time and ask questions if they have any. And if you don't think you'll be able to watch, then you can ask us questions ahead of time and we'll answer them actually in the video itself. So hopefully that gives you something to get started with on understanding what it is that we look for when we're looking at our dog's mouths, what it is that your vet will be looking for when they go in for their annual checks. And they have a little look and they say, oh yes, we need to do a little bit with their teeth there. That's what they're looking for. They're not just looking at the front to see if they're clean or not. The front often are the ones that look the best. Meanwhile, in the back, all sorts of things are happening. So just being aware of it's the teeth, all the teeth, it's the gum line, it's what's happening beneath the gum line, which we can't see. But that's why sometimes x-rays will come up with more things. And that's why your dentist, I keep calling him a dentist, that's why your vet will be able to do a lot more to help your dog if they do need their teeth cleaned, if they do have some gum disease issues. Then more than we can, because we can't get below the gum line safely and they can. Okay, so have a read through your email, have a look at all the information that's in there, and then take a look at the first task and take part if you would like. So it's something you can just do on your own at home, but if you would like to take part, then you'll see in the email how you can just take part and let us know what you feel the scoring is. And it's not because we're going to come down on people and be judgy, it's just because, it's nice to see other people will be going through exactly the same thing. My youngest dog